Hey everyone, and welcome back. We're diving into a topic today that's generating a lot of buzz in the world of mental health, TMS therapy.
It stands for Transcranial Magnetic Stimulation, and it's offering new hope for people who haven't found relief through traditional treatments like medication or therapy.
It sounds pretty futuristic, to be honest,
Yeah.
using magnetic fields to stimulate the brain. So how does it actually work?
Well, imagine you have a really complex electrical system, and there are a few circuits that aren't firing quite right.
Okay, I can picture that.
TMS is like using a very precise magnetic pulse to adjust those circuits, to get them back online and functioning more optimally.
So it's not about shocking the brain or anything like that?
Not at all. It's much more about gently nudging brain activity in a more positive direction. Interesting. So for someone who's struggling with, say, depression, what can TMS therapy actually do?
That's a great question. For people with major depressive disorder, TMS often targets an area of the brain called the prefrontal cortex, which is involved in mood regulation.
Right, I've heard of that part of the brain.
By stimulating this area with magnetic pulses, TMS can help to increase activity in areas that are underactive in people with depression.
So it's like giving the brain a jump start in the areas that need it most.
Exactly. It's about restoring balance and helping the brain function more effectively.
Now, I know a lot of people listening have probably tried various medications for depression with mixed results. How does TMS compare? Is it a cure-all?
TMS is definitely not a cure-all, and it's important to have realistic expectations. However, it's showing incredible promise for people who haven't had success with other treatment options.
So for someone who's feeling like they've tried everything and are out of options, TMS could be a game changer.
It very well could be. What's remarkable is that it's a non-invasive procedure. So unlike surgery or implants, there's no need for any incisions or recovery time.
That's a huge plus for people who might be hesitant about more invasive procedures. So walk us through what a typical TMS session looks like. What can someone expect when they walk into a clinic?
It's much less intimidating than you might think. You'll sit comfortably in a chair, similar to a dentist chair.
Hopefully more comfortable than the dentist.
You wear earplugs because the machine makes a clicking sound as it delivers the magnetic pulses.
I've heard it's similar to an MRI machine.
That's right. It's a similar type of clicking sound. A technician will place a special coil on your scalp, usually on your forehead, for depression treatment.
And that's where the magnetic pulses are delivered.
Precisely. And you might feel a tapping sensation on your scalp where the coil is positioned.
Is it painful at all?
Most people find it completely tolerable. It's not like a sharp pain, more of a tapping or tinkling sensation.
That's good to know. And how long do these sessions last?
A typical session lasts around 20–40 minutes.
So it's not something you can necessarily squeeze into a lunch break.
Right, it does require a bit of a time commitment, especially considering that most people need multiple sessions per week, often for several weeks.
So we're talking about a course of treatment here, not just a one-time thing.
Exactly, it's a process, but the potential benefits can be life-changing for many people.
That makes sense. So now that we have a better grasp on the basics, let's dive into who might benefit most from TMS therapy. So who is TMS therapy really for? Who might be a good candidate?
Well, it's often recommended for people who haven't responded well to traditional treatments like medications or therapy.
Makes sense. So someone who's tried several different antidepressants, for example, and hasn't found relief.
Exactly. TMS can be particularly helpful for people with major depressive disorder who fall into that category.
So it's not necessarily the first line of treatment, but more like a beacon of hope for those who've hit a wall with other options.
You could say that, yes. It offers a different approach that can be life-changing for some people.
Are there any other factors that might make someone a good candidate?
Yeah, definitely. TMS might be a good option for people who can't tolerate the side effects of antidepressants or other medications.
Oh, that's a good point. Medications can be tough, especially if you're prone to side effects.
Right. And it's not just about the severity of the side effects.
Yeah,
Some people simply don't want to be on medication long-term, and that's perfectly valid.
absolutely. So TMS offers a medication-free alternative that could be much more appealing for those individuals.
Precisely. Now, on the flip side, there are some instances where TMS might not be suitable.
Okay, that makes sense. It's not a one-size-fits-all solution.
Right. For example, people who have metal implants in their head, like a pacemaker or certain types of aneurysm clips, typically can't undergo TMS.
Oh, wow. I can see why that would be a concern.
Yeah, the magnetic pulses could potentially interfere with those devices.
That makes sense. What about other medical conditions? Are there any red flags there?
A history of seizures or epilepsy is something that doctors would definitely consider.
So it's really important to have that open conversation with your doctor, be completely upfront about your medical history, and make sure TMS is a safe and appropriate option.
Absolutely. It's all about weighing the potential benefits against any risks.
Now, I want to switch gears for a moment and talk about the actual TMS experience. We touched on it a bit earlier, but I'd love to paint a clearer picture for our listeners. Once someone decides to move forward with TMS, what can they expect during a typical session?
Sure, so the first thing to remember is that TMS is non-invasive. There are no needles or incisions involved.
That's always good to hear.
You'll be awake and alert throughout the entire session. You'll sit comfortably in a chair, kind of like a reclined dentist chair, but much more relaxing.
I was going to say, hopefully it's a better experience than going to the dentist.
You'll wear earplugs during the treatment because the TMS machine makes a clicking sound as it delivers those magnetic pulses.
I've heard it's similar to an MRI machine. Have you ever had an MRI?
Exactly. It's
Yeah.
that same kind of clicking sound.
Hmm.
But the noise isn't painful or anything like that. It's just something to be aware of.
Okay, good to know. So you're settled in, earplugs in. What happens next?
A technician will position the TMS coil on your scalp. For depression treatment, this is usually placed on your forehead, right above your eyebrows.
And that's where the magnetic pulses are delivered to stimulate the brain.
Yep, exactly. You'll feel a tapping sensation on your scalp where the coil is positioned.
Like someone's tapping their finger on your forehead.
Sort of like that, yeah. It varies from person to person, but it shouldn't be painful.
What about those magnetic pulses? Can you feel them?
You won't feel the magnetic pulses themselves, just that tapping sensation from the coil.
That's good. It is always reassuring to know what to expect. So how long do these TMS sessions last?
A typical session is about 20–40 minutes.
So it's not something you can necessarily squeeze into a lunch break.
Yeah, you might need to adjust your schedule a bit. It's a bit of a time commitment,
Mm.
especially since most people need sessions 4 or 5 days a week for several weeks.
It's not a quick fix. It's more like a course of treatment.
It's about being consistent and dedicated to the process.
So before we wrap up this part of our deep dive on TMS, is there anything else people should know about what to expect during or after a session?
It's worth mentioning that while TMS is generally considered safe and well tolerated, some people might experience mild side effects.
Like what kind of side effects are we talking about?
Headaches are probably the most common side effect. Some people also report scalp discomfort at the treatment site.
So pretty localized to the area where the coil is placed.
Right. And in most cases, these side effects are mild and temporary, tending to subside as treatment progresses.
Okay, so it's not completely side effect free, but thankfully they seem manageable.
Exactly. It's always important to talk to your doctor if you have any concerns about side effects.
Now, we've talked a lot about the mechanics of TMS therapy, but let's shift gears and delve into the research. Does science actually back up what we've been discussing? We'll dive into that right after this. We're back and ready to dig into the research behind TMS therapy. Does the science really hold up to the hype?
Well, there's been a lot of research, especially for treatment-resistant depression, and the results have been pretty impressive.
So we're talking about people who've tried antidepressants, maybe even therapy, but haven't found lasting relief.
Exactly. Studies have shown that TMS can significantly reduce depressive symptoms in this group, sometimes even leading to complete remission.
Wow, complete remission. That's incredible. It really highlights the potential of TMS to transform lives. But how does it actually work in the brain? What's going on at a neurological level?
That's the really fascinating part. Research suggests that TMS can actually change brain activity in areas that play a key role in mood regulation.
Okay, so it's not just a placebo effect. There are measurable changes happening in the brain.
Exactly. For example, studies have shown that TMS can increase activity in the prefrontal cortex, an area that's often underactive in people with depression.
And the prefrontal cortex, that's kind of like the command center for things like mood, motivation, decision-making.
Got it. So by stimulating that area, TMS seems to help it function more optimally.
It's like giving that part of the brain a much-needed boost. But what about the long-term effects of TMS? Is it a temporary fix, or can these changes last?
That's the million-dollar question, and it's one that researchers are still exploring. Since TMS is a relatively new treatment, long-term data is still being gathered.
That's understandable. New treatments always come with a bit of a wait-and-see period.
Right. But the good news is that the research we do have so far is pretty encouraging. Some studies have followed patients for several years after TMS treatment, and the results suggest that the benefits can be long-lasting for some people.
That's reassuring to hear. So there's hope that TMS isn't just a Band-Aid solution. It could actually lead to sustained improvement in brain function and mood.
Exactly. And I think that's what makes TMS so revolutionary. It's not about masking symptoms. It's about potentially creating lasting changes in the brain.
It's like you said earlier, rewiring those neural circuits for the better.
Precisely. Now, it's important to note that TMS isn't a magic bullet. It doesn't work for everyone. And more research is always being done.
Right, it's not a one-size-fits-all solution.
Exactly. But for those who have struggled to find relief from depression through other methods, TMS offers a new avenue of hope. It's non-invasive, generally safe, and the research on its effectiveness is incredibly promising.
Absolutely. And as we wrap up our deep dive into TMS therapy today, I think it's important to emphasize that this is just the beginning. Research is ongoing, not only for depression, but for a whole range of other conditions.
Exactly. We're learning more every day about the potential of TMS to treat things like anxiety, PTSD, even neurological disorders. It's an incredibly exciting time for brain science and mental health treatment.
It really is. Who knows what the future holds for TMS? Maybe it'll become a standard treatment option for a wide range of conditions.
Imagine that. The possibilities are truly remarkable. But for now, if you're listening to this and thinking TMS might be right for you, the best thing you can do is talk to your doctor.
Absolutely. They can help you weigh the risks and benefits and guide you toward the best treatment path for your unique needs. Until next time, keep exploring, keep asking questions, and keep diving deep.